My name is Victoria. I was part of doing the very first online prenatal class.
My name is Shauna, and I'm currently a volunteer with the Strathmore Pregnancy Care Center.
My name's Carol. I started out as a prenatal instructor. Most recently, I'm a client support person.
My name's Joanne Hunt, and I am a volunteer with Client Services.
My name is Chinwendu. I work for Legacy Kitchens, and we deliver meals to the Calgary Pregnancy Care Center in Strathmore.
My name is Sharon Vanderburgt, and at the moment I teach the financial literacy course.
My name is Crystal, and I do a variety of things around here at the center. Here in Strathmore, we all pretty much do lots of stuff.
My name is APCC Somi Lamai. I teach prenatal classes at the Pregnancy Care Center.
I wanted to talk to women who had limited support and see what I could do to help them out.
I'm a doctor, a medical doctor. I was working in women's health. So moving to Canada, I had to go to school, and I really wanted to get back to helping out pregnant women.
I worked as a teacher for many years, and I was coming up to 60 and thought, well, it's probably time to move on and do something a little different. Now, I was an adopted child as an infant. It was a way of giving a thank you to my birth mother. I did, in my heart, want to thank her for just giving me that opportunity to have a really good life and a really happy and fulfilled life.
I was a single parent for about 3 or 4 years, and also a very young mom. I was 19 when I had my first baby. And so that has always played on my heart, and I've always wanted to work with young women because I went through the struggles.
I have personally faced unplanned pregnancy, and I've also experienced the crushing aftermath of an abortion decision. And I find that women who come to us for help with their post-abortion grief are very deeply comforted by the fact that I have also walked a mile in their shoes.
I felt that pregnant women and their partners in this season were just facing so much uncertainty. It was really awesome to be part of just giving them practical information that could help them feel empowered.
So it was basically get on the phone, start contacting people, letting them know that we're here.
It's been very interesting doing Zoom meetings. So I was doing Zoom meetings with baby's first year.
At the beginning, I did helpline once a week. I also delivered some meals to a client and clothing to them when they couldn't come in. We just sort of covered whatever needs that they had.
I handled incoming calls so that freed up staff members at the center to be able to do other things. I would speak to clients and ascertain what their various needs were and then figure out how we could best help them.
Once COVID hit, I felt even more empathy for the women reaching out for help because I deeply suspected that many, many of these women were suffering in isolation.
It was really cool to just kind of combine my worlds as a postpartum public health nurse, and now then teaching a prenatal class, just to kind of bring those two together.
By the time we got to week 5, and on our break, I left my video on, I ran to get a coffee, I'd come back and I'd allow for that 10 or 15 minute break, but a lot of people would engage just on the personal level, which by week 5, we had actually created some relationships, and I really, really missed not seeing my clients the following week.
They were very happy. Often they were quite thankful that despite the pandemic, we kept the class going.
Churches throughout the city really stepped up, and they'd set up a lot of different supply centers around the city for people to access. So we were able to connect people with that kind of service. We found that people were extremely grateful. It was just a real good time of people coming together and caring together in an atmosphere where things had become very negative, very stressed.
I got to meet with people that not necessarily would have been able to come into the center, so that they actually were able to reach out when they needed to reach out rather than not being able to gather that support.
When we started making deliveries, like when people needed diapers or those meals for moms, and that I was able to just go and deliver some of the stuff. So we got to, wave at our clients through the window, which was amazing. You could just see the big smile on their face too. Or if it was nice day, they'd stand on the porch and I'd stand down below. And I had one client that her dad passed away over this COVID. So I was able to help her with that, not just with the babies, but also with trying to walk her through her grief. I got a feeling of a different connection with my clients, a stronger one.
We have actually had quite an influx of women reaching out for help.
I feel like people just need to go out there, step out, because you think it's very small. It's as small as like, oh, we're just going to go there and drop off meals. We're going to go pick up meals and deliver. You're actually blessing people. You're changing lives. You're a part of someone's story that you don't even know.
All the people at this time who really did step up to the plate to help people whose faces they couldn't see. They didn't hear the stories of the individuals coming across our phone lines. They made a huge, huge difference in people's lives. So thank you.